Metals are much more allergenic than we typically give them credit for. Does anyone remember being told in dental school to ask patients if their skin breaks out with jewelry? Very few patients ever report having been asked that by a dentist. Dentists may pre-screen their materials and diagnose local reactions in the mouth, but toxic or immune illness is a medical diagnosis. Dentists are not usually allowed to make such a diagnosis under terms of a dental license. In most jurisdictions, dentists may accept a patient's request to replace specific materials like mercury fillings, but may not independently make a diagnosis of systemic illness like MCS or mercury toxicity. This means that biocompatible dental practice is interdisciplinary. While there are a number of ways that a dentist can test patients for reactivity for dental materials, the IAOMT encourages its members to develop good working relationships with physicians and other practitioners who understand the issues we deal with.
Allergy testing can be used to assist in identifying some of the individuals susceptible to adverse reactions to metals. Patch testing is generally regarded as the gold standard in allergy testing. However, patch testing has also been criticized because it involves directly applying the allergen to the skin. It can exacerbate symptoms in patients, it can result in sensitization, and the results can be affected by other conditions. Two relatively new alternatives to skin patch testing are a modified version of the lymphocyte transformation test, LTT, known as MELISA, and the lymphocyte response assay, LRA, by ELISA/ACT. Another option for testing has been created specifically for dental materials. If this biological testing is used, a patient's blood sample is sent to a laboratory where the serum is evaluated for the presence of IgG and IgM antibodies to the chemical ingredients used in dental products. The patient is then provided with a detailed list of which name brand dental materials are safe for their use and which ones could result in a reaction. Two labs that currently offer this service are BioComp Laboratories and Clifford Consulting and Research.